Anything I ate just came back up. Oh, the pain.
I started losing a bunch of weight. My mom thought I had an eating disorder. Like, she'd wrong.
The pain in my gut was so bad I couldn't eat or even think of taking a sip of water.
My parents and doctors thought it was a side effect of the medicine. I wish it was the medicine.
When I woke up from the operation, my parents were nowhere in sight. I was in severe pain.
My name is Zachary. I'm 13 years old, and I have Crohn's disease. There are over 1.5 million people in the world living with Crohn's disease. In the United States alone, there are 700,000 cases, 80,000 of which are children. Crohn's is an inflammatory bowel disease, or IBD. An IBD is a disease that affects your digestive system, also known as the gastrointestinal or GI system of the human body.
Crohn's disease is an autoimmune disease that affects mouth to anus. It causes inflammation of the bowels.
The GI system starts with the mouth, the esophagus, the stomach, small intestine, colon, and anal region. That's right, your anus.
Crohn's disease is named after the doctor who first discovered it in 1932, and most commonly affects the end of the small bowel, called the ileum, but it may affect any part of the GI tract.
The cause of Crohn's disease is still unknown.
There are probably genetic and environmental factors that play a role.
Some symptoms of Crohn's are persistent diarrhea, severe abdominal cramps or pain, fever, loss of appetite, weight loss, and fatigue.
When I was younger, it was a lot of gut pain. As I've gotten older, my disease has moved areas.
These are common side effects to some medications people take and other diseases and issues. Therefore, Crohn's is often misdiagnosed. Most people try to manage their own symptoms, not knowing they have Crohn's. When the pain gets really bad, they typically go to the emergency room. In the ER, you will see a GI, a doctor who specializes in intestinal diseases.
So my job as a gastroenterologist involves seeing people in an office setting, and taking care of patients in the hospital and doing procedures.
Have you ever had an X-ray or a blood test or even a CAT scan? You get lots of these and similar tests when they are diagnosing Crohn's disease. Two of the most important tests are colonoscopies and endoscopies. An endoscopy is when they put a tiny camera on the end of a flexible tube and they push it down your throat, taking pictures inside of your esophagus and small intestine. That is as far as they can go. To get to the large intestine, they do the same thing, but go up your anus. It sounds really gross, but you are completely sedated and don't know what is going on. They give you anesthesia and you're out. When you wake up, you're like that kid on YouTube after the dentist.
I feel funny.
Sadly, Crohn's disease currently does not have a cure. However, it is very manageable. Depending on how bad your Crohn's is, you will have to avoid certain foods. For example, I cannot have popcorn and peanuts. So going to movies and baseball games is pretty lame.
Would you like some popcorn?
I can't have it. I have Crohn's disease.
Oh, popcorn!
Crohn's might be very minor and require very little maintenance, or it could be major and involve some pretty big life changes. I met kids who even had to wear a colostomy bag or a feeding tube. Luckily, my Crohn's isn't so bad, so all I needed was an operation and medication. There are lots of medications that can help maintain Crohn's to avoid pain and symptoms. One of the best is Remicade, which is given through an IV every few weeks to many Crohn's patients, including myself. If a Crohn's patient needs surgery, portions of the digestive tract are often removed. This is usually the last resort, and doctors try everything they can before playing the surgery card. In my surgery, they took out a foot of my intestine. Crohn's treatment has been making great advancements over the past 15 years. Fewer patients are needing surgery, and the surgeries themselves are becoming easier and less invasive, using a new method called laparoscopic surgery. Surgeons can use tiny little robots with cameras that go inside of your body. Because of the robot's small size, they cut smaller incisions, which causes less pain and speeds up recovery time. In addition to surgical advancements, lots of new medications are in development. One of these is Mongersen from Celgene. Unlike other Crohn's medications, it comes in pill form. It is still being tested and hasn't even been used in the US yet because of FDA regulations. So far, the testing results have been amazing. Patients who took the higher doses showed very high rates of remission. The highest dose resulted in 65% clinical remission within less than a month. Severine Vermeer, an award-winning GI, says, if confirmed in future studies, this durable effect of Mongersen would be unprecedented and would represent a first step towards curing the disease. Here are a few things you should remember about Crohn's disease. You might think it is gross, but it is very common. It is not contagious. There is no cure, but it is very manageable. People with Crohn's are just like everyone else. It doesn't stop them from living a normal life.
You absolutely can live a normal life with Crohn's disease. I wouldn't be able to do the job that I do, if it was constantly bothering me.
Nothing is guaranteed in life. We all have challenges we have to deal with, and having Crohn's is my challenge.